Okay, we have one from Tori. How can I continue to improve my mental health without obsessive feelings? I need to change everything about myself. Thank you. Obsessive feelings, or maybe she's referring to, or he's referring to obsessive thoughts. Definitely with therapy, this therapy can be beneficial. And what I mean by that is it takes a lot of practice to work on the thought processes of themselves. Now, it depends on what the obsessive feelings or thoughts are, on how you would work on them. But it's a lot of it is about seeing if there's any triggers. Sometimes there are triggers to the obsessive thought or feeling, like for instance, feeling unsafe, feeling scared, being in an environment that triggers anxiety, etc. So understanding what the triggers are is first, and then working with the therapist to perhaps give you a little bit of exposure to that trigger, and then work through those obsessive thoughts, what they are, and then perhaps some CBT as well could be beneficial in helping that. So it's not so much changing yourself, it's changing the way you're viewing that situation that's triggering the obsessive thoughts or feelings, and then reframing them. That would be the process of CBT. So he had a question about mirtazapine causing nightmares. So I'll repeat what I said. So with mirtazapine causing nightmares, so some people can be very sensitive to serotonin, and serotonin is your precursor to melatonin. And high levels, meaning too much, so say you don't even have a deficiency, which oftentimes you don't. But so say that's the case, and now you're taking something that's increasing serotonin as well as other neurotransmitters, because mirtazapine is multimodal. But serotonin, some people will have like strange dreams, more vivid dreams. They can more dream recall. So whether or not that translates into nightmares is depending on your subconscious, if you have a history of PTSD, fear, anxiety, etc. And so that's something that can occur. Another thing to consider when you believe medications are causing nightmares is the fact of the stages of sleep. So meaning, when you're in REM sleep, you should then, after REM, go into deep and then light sleep, right? So if you wake up immediately after REM, then you're going to be more aware of your dreams and these so-called nightmares, right? And so wanting to make sure that you keep a sleep journal or sleep diary to document the time you're falling asleep, if you're having any wake up times, like when you're having these nightmares, etc., and making sure you're following good sleep hygiene practices, because it may be because you're not actually going through the full stages of sleep as well. But yes, serotonin in and of itself can lead to these strange dreams, vivid dreams, and for some people, nightmares. So that is something to be cautious of. Another one from Ismail from Algeria. So he's saying, good morning. I'm not a doctor, by the way. I'm a psychiatric nurse practitioner. I have to always make sure that's clear. But I know in other countries, you guys don't have a role for a psychiatric nurse practitioner. And so I get it. But I just always want to make sure that that's clear, because I never want to be accused of misrepresenting myself, okay? That's a big deal, especially here in the US. So I am a psychiatric nurse practitioner, and yes, I can prescribe medications, and I manage patients with mental health problems. Okay, so my name is Ismail. I'm 28 years old, BMI 36, that's pretty high. I had bipolar 2 rapid cycling, GAD, and chronic insomnia. Since 2 months, I've taken lamotrigine, Symbyax, and mirtazapine. Insomnia has eased, however, I've had nightmares. So, okay, nearly every night. Is it a side effect of mirtazapine? In recent days, my fasting blood sugar is high. Okay, that's important. Maybe because of Symbyax. I fear developing diabetes, which you advised me. Thank you very much. So yes, you had the question about the nightmares, which I explained that. However, this high blood sugar can be a factor too. Why? Because when your blood sugar is spiking, so is insulin, and then cortisol as well. And so so that can also be disrupting your sleep response, but also causing a lot of inflammation. And so that can be problematic. Yes, it can be from medications. meaning the medications of themselves, like even mirtazapine, the Symbyax has the olanzapine in it, but they can increase your appetite significantly and lead to something called metabolic syndrome, which can lead to diabetes. And I talk about that in those different videos where metabolic syndrome is a factor, as with olanzapine, which is in Symbyax. So, so definitely what you want to do, and what studies have shown, is that exercise is going to be very beneficial to help reduce this side effect, as well as monitoring your diet and what you're eating. So if you're having a lot of cravings, especially oftentimes the cravings are going to be for sweets, carbohydrates, and those types of things, to replace it with things such as water, like apples, grapes, things that are going to fill you up because they have a lot of water in them, but not be too hard as far as too many carbs or too many sugars, but still kind of satisfy that sweet craving. So only having available to you in your home healthy foods, because obviously when you have a craving and you have donuts and cookies and chips and snacks in your home, that's what you're going to go to. So you have to throw all that out and replace it with fruits and vegetables and satisfy your cravings that way, so it'll be a less impact on your weight and on this developing of diabetes. Another important thing is protein, and protein is going to help stabilize your blood sugar as well. And so making sure that, for instance, if you're having an apple, perhaps having that with peanut butter, good source of protein. So that way the blood sugar spikes will be less as well. So anytime you're having lots of carbs, making sure you're pairing it with a good source of protein. That's very important for blood sugar stabilization. And that is what I would advise there. So talk to your provider about that. Also getting labs to make sure, oftentimes what I see, especially with GAD, with spikes in blood sugar, may not be related to the medication itself, but could be related to adrenal gland dysfunction, just because of the added stressors and the increase in stress. So be aware of that, okay? Input on Mydayis. Mydayis is a type of stimulant medication. It's like an amphetamine mixed salt. I only use it a few times, so I don't really have a lot of input on it. Though what I can say about it is that oftentimes if patients don't do well with like Adderall XR, extended release, or even Vyvanse tends to be one of the best, like the Cadillac of the stimulants, but say you don't respond to that, then they usually will respond to this Mydayis. I'm not sure how to pronounce it exactly, but the one thing I don't like about it is the fact that it is branded, and so you have to go through a couple of hoops. If you have insurance. If you don't have insurance, then you're going to have to pay quite a bit out of pocket for it. You may be able to get some discounts on GoodRx for it. But like I said, I don't have too much experience of it because of that, because it's still branded, it's still expensive. The few patients that I've had on it have really liked it, say that it works really well, has a very long half-life, and so oftentimes works really well for those patients who need that longer duration of action. For saying if you're in college or something like that and you just need a longer duration. But like I said, oftentimes cost is a factor and not being able to prescribe it to patients.